The goal of biosecurity is to protect individuals and communities or the environment from any biological threat. So the scope includes a large collection of measures that are designed to prevent the spread of infectious disease from humans to humans, sometimes from animals to humans, and in a larger sense, to prevent incursion of any damaging species into the environment. So in practice, biosecurity includes mitigating the effects of an infectious disease outbreak if prevention has failed, assisting in remediation and recovery of communities after an infectious disease outbreak, and importantly, it's based in an all-source hazards model, recognizing that there's an intimate relationship among animals, humans, organisms, and the environment. The Institute for Biosecurity provides training in the science of biosecurity and its many methods, and we're located within the School of Public Health at St. Louis University. So for more than a decade, we've pioneered the use of distance learning techniques to train professionals already in the field with courses in infectious disease agents, including those that might cause large-scale pandemics or outbreaks. And we also stress prevention and infection control measures and even biosecurity policy to inform decision makers. The Institute is one of the few biosecurity and disaster preparedness training programs that's located within an accredited School of Public Health. We are founded in public health principles and practice, and that includes preparedness and response training for other disasters such as earthquakes or adverse weather events. Our Masters of Science program is available completely online, and perhaps most importantly, we have a practice-based and research-based environment that drives our entire curriculum. So what really makes us different is that our instruction is science-based. That is, it's based on biological science, infectious disease, and epidemiology. The graduates work in a wide variety of settings. They work in community public health, they work in federal agencies, and increasingly, they're finding employment in private industry. The reason for that is that private industry has a concern for biological events that may undermine the effectiveness of their employees or may impact the core business of the enterprise, for example, in agribusinesses. We offer courses in business continuity as well, so our graduates are prepared to meet the needs of companies that have to consider a wide variety of biothreat scenarios. We have a unique focus on biological threats that are often overlooked by other degree programs, for example, bioterrorism. And since multinational corporations are obviously concerned with transmissible infectious disease and its early recognition, we give our students deep preparation in order to respond to infectious disease outbreaks. Our faculty have a wide range of practical community experiences. For example, they have real-world expertise in countering bioterrorism, in implementing programs for addressing pandemic disease and response to pandemic disease, and also they work closely with first responders to enhance their preparedness. Many of our Masters of Science students are already employed professionals. For example, they may be in nursing, emergency medicine, emergency response, or even business analysts. By completing an MS degree at the Institute, they can advance their careers, provide sought-after specialty expertise in biological disaster preparedness, and also work in community settings. We also offer a Master of Public Health or an MPH degree in Biosecurity and Disaster Preparedness, and most of these students have an undergraduate degree in biology or some other science, such as psychology or sociology. After completing an MPH degree, students can join public health departments, and we find that doctors, nurses, and other professionals also seek MPH degrees in biosecurity to advance their careers. At the Institute for Biosecurity, our curriculum is evolving to keep pace with the changing requirements from employers. So as an example, we have 2 new Masters of Science tracks, one concentrating in medical and public health intelligence and the other in infection control. The students who specialize in medical and public health intelligence will be able to analyze a wide variety of information regarding actual disease outbreaks and provide tailored recommendations to decision makers in industry or in government agencies. The students who choose the infection control track will be able to assist epidemiologists, public health officials, and hospital system specialists in identifying and quickly responding to infectious disease outbreaks at a local or regional level. Also, we offer a joint Masters of Public Health program in Epidemiology and Biosecurity and one in Environmental Health and Biosecurity. So graduates who complete these programs are well trained for careers in standard public health with a sophisticated knowledge in the problems of bioterrorism, pandemic infectious disease, and disaster planning and response. The MPH programs are offered in a hybrid fashion. Some of the classes are more traditional classroom setting instruction, while other classes are taught online. If you're interested in applying to our program or have any questions at all, my colleagues and I are always happy to speak directly with interested students. So just give us a call, drop us an email, and we'll set up a time to answer any questions that you may have about the Institute or its curriculum. And please take the time to explore our website and hear from some of our graduates and their experiences after graduating from the Institute of Biosecurity.